This is the time to stand up now. We can't carry on like this.
Very, very good morning. It is just over 48 hours away from a public meeting in Royton. 7:30 p.m, public meeting in Royton, called by concerned residents of Royton. First and foremost, it's not the Royton Independents. First and foremost, these are concerned residents of Royton. And they have contacted Jim McMahon MP. He hasn't replied. This is a man who claims an over 80,000 basic salary, has a staff team of hundreds of thousands of pounds in terms of salaries, expenses of £200,000 a year. You pay his heating bills on top of that, and he hasn't replied to his own constituents, because Oldham West and Royton, the Royton bit is part of Oldham West. He isn't just MP for the Muslims in Cllrs, Werneth, Coppice. Royton is part of his constituency, and he hasn't responded. I spoke to one of the Royton Independents earlier. Deeply disappointed. The person I spoke to wasn't one of the Royton Independents. They'd just been volunteering, helping coordinate this meeting. Concerned residents, deeply alarmed, shocked by the findings and the role of the Labour Party Deputy Mayor of Oldham Council, Dr ZAHID CHAUHAN, and how his name had mysteriously disappeared from the webpage after first being difficult to locate, shall we say. Amanda Chadderton, the leader of Oldham Council, is also a councillor for Royton South. She's the councillor for Royton South and has been since he first became councillor. Amanda Chadderton has not responded either. Contemptuous behaviour. The leader of Oldham Council, who is also a Royton councillor, has been invited by the people of Royton to attend a public meeting to hear their concerns and respond accordingly. Has not responded. Marie Bashforth, Steve Bashforth, nothing from them. And Dr ZAHID CHAUHAN, who's keen to tell everyone it's not his company, this Bardock, through his press releases. Well, I've got a surprise for Dr ZAHID CHAUHAN in a minute. No response. This is the doctor's surgery that is being exposed for falling far, far shorter than what any of us should expect. Jim McMahon, the MP, has been attempting to cover it up by saying there's loads of other places that are under similar circumstances and it's the government's fault to do with funding. Nonsense. Absolute nonsense, because there are plenty of doctors, surgeries, medical centres that aren't inadequate, that have been deemed inadequate in categories or required improvements overall. There are plenty. Royton, the other Royton one, is just one of those. So even those Amanda Chadderton and her mates have attempted to smear that health centre was determined to be good by the Care Quality Commission. I don't know what's worse. Them not turning up to a meeting or not even acknowledging the invitation. This is staggering behaviour from the town's politicians who have been exposed. I mean, take a step back. Let's take a step back. Should they be attending a public meeting? Of course they should. Should they be answering questions and listening to concerns? Of course they should. Do they get paid by you? Are they elected by you? Yes, and yes again. So why are they in hiding? Why are they in hiding? So this is what I would do. Now I have been invited to the meeting. Maggie Hurley sent me an email yesterday morning inviting me to the meeting. It's not my party. It's not my meeting. I've not organised it. The only role I have with the Royton Independents is the same role I've had with every other political party in this town. They listen to my transmissions, they take my advice, or they don't. They use what I have come up with and, go and do what they do. So no, it's not my meeting. And someone from Royton, one of the supporters from Royton, phoned me up earlier and asked me if I'd be there because they'd like to speak to me afterwards. So I'm going to try and get there on Thursday evening and watch. That's exactly what it is, Marley. It's a cover-up. This is an attempted cover-up by Amanda Chadderton, the leader of Oldham Council. She won't even come and face the people of Royton, whose children have been placed at risk by this medical centre. Because that's what is it. That's what not conducting DBS checks is. Whose elderly members of their family's lives have been risked. Because that's what happens when you don't prescribe your medicines properly, or you don't administer your medicine properly, or you don't have the right equipment available. It's a very simple question, isn't it, Denise? There's nothing generic. Are you coming to the meeting? Are you coming to the meeting? Of course, if they don't come to the meeting, if it was me, I'd set out empty chairs. I'd set out the chairs at the front. I'd get some plaques. The name Jim McMahon, Amanda Chadderton, Maria BASFORTH, Dr Chauhan. Me being me, I'd get a series of blow-up dolls and sit them there. If they don't turn up. It's a tactic. It's a political tactic. Used many times. You empty chair them. You shame them to the members of the public who attend. And it will be well attended. I'm sure it will be well attended. And that's it, isn't it? I mean, that's one of the reasons why I've described it as a death trap. It's the same at the Failsworth place, isn't it, Denise? Not just the smear shortcomings, the smear test shortcomings, but also the claim that children's vaccines were at 100%. And when the analysis by the Care Quality Commission showed not only were they not at 100%, they had concerns. In hiding. So I'd empty chair them. If I was Maggie and her team, I'd empty chair them. Because they're not me, are they? They do that. I think that's acceptable. I'd get some I'd blow up some condoms. and put a plate of samosas, a barrel of beer, and a wad of Monopoly money, and a stethoscope, maybe a tombstone. I'd just take the piss. Because that's what they deserve. If they treat you with contempt, then you should do likewise and more. And of course, this isn't a laughing matter, and you can see I'm not laughing. This is very, very serious. He says, just as he reads David's posts, probably get more honesty from a blow-up doll. There you go. I hope they've invited the press. I hope they've invited Olivia Bridge from the Oldham Times. And if she doesn't turn up, I think that says everything about her. I hope they've invited Charlotte Green. And if Charlotte Green doesn't turn up, I think that shows everything about her. I'm afraid I don't know any of the Oldham Chronicle reporters. Who, by the way, have removed their article. If I was the Conservative councillors, Lewis Quigg and Dave Arnott, even though I've not been asked to attend, it's a public meeting, and they are members of the public of Royton, I would also be there to show solidarity and concern. But they've put nothing up on their Facebook page. And what they've come up with is extremely... It's piss poor, isn't it? It's piss poor. So, Thursday, 7:30. I saw Jeanette here earlier. I think I put a post up to say hello. So, Jeanette, do put up, please, again, the location, and I'll share it on the screen. Thank you, Nicola. I'm imagining one of those Ali Akbar backdrops. I've seen the one he's done of is it Dr Chauhan? I think it looks like with the sky as though he's Dr Death. I know we're mocking. I know we're mocking him. But he's not issued a single statement about the shortcomings in his medical centres, in both his medical centres in Oldham. McMahon refuses to condemn. I just want to quickly go through everything again because I want to take us to a place. So if you're with me, please bear with me. I think you'll find value in this. I spent yesterday evening just with my mind whirring away on this. And it didn't make sense to do with Dr. Chauhan and Bardock and all the rest of it. So I went back to the beginning and I started again. And I think I've made sense. A lot more sense. And you will be alarmed. You will be alarmed. Because I've done what I was trained to do. I follow the paper trail, I go back to the beginning and I work my way systematically through it. It took me a while. Let's start at the beginning. If you are finding value in these transmissions, and I'm amazed there's 72 of you watching at 11:30 on a Tuesday morning. If you're finding value in these transmissions, please like, please share. Ali Akbar mentioned me earlier. Good morning, Tony. Apparently, my notifications aren't coming up on Facebook. No, they're not coming up on Facebook in the way they used to, because Facebook have restricted my posts. And the reason they restricted my posts was because they've had reports that I'm inciting terrorism and violence. If that was true, I would have been arrested. So clearly the reports have come from Greater Manchester Police or senior politicians who had the authority to force Facebook to act that way. Am I inciting terrorism, encouraging violence by raising concerns about the political shortcomings in our town and the cover-up of the grooming and gang rape of our town's children, and now what's emerged regarding Dr CHAUHAN and Royton Medical Centre and Medlock Medical Centre? Thank you, Jeanette. 7:30 p.m, Royton Band Club, Sandy Lane, OL2 5QP. I will be there. I'll be sat at the back. It's not my meeting. I will come to observe. I'll happily talk to people afterwards, but I encourage you to attend. And let's see if Amanda Chaddерton has the courage to demonstrate the leadership role she has taken on. Let's see if Jim McMahon has the bravery to step away from his Muslim core vote supporters in Cllrs and Chaddерton and Coppice and Werneth, and come and face the predominantly white working class communities in Royton who have been failed by this doctor's surgery. Let's see if Barrelgate Bashforth and his wife, who are keen to give it the big who they are in Royton as politicians, let's see if they turn up. Let's see if Piffian turns up. And whether Quigg and Arnott have any spine whatsoever. So let's see. Okay. Let me bring up the iPad. Quickly go through this. This was the first story that came out, remember? Royton Medical Centre requires improvement, the CQC rules. This disgraceful so-called journalist wrote it, was involved in the cover-up at the time. Olivia Bridge. A Royton GP surgery has been told it must improve after the health watchdog found the practice in breach of legal standards. Care Quality Commission inspectors heavily criticised leadership at Royton Medical Practice in their report, saying they did not see evidence leadership could deliver high quality care. Well, why did she omit who the leadership was? Inadequate, the lowest possible rating for the practice's leadership. Published last week based on an inspection in September, it was the first at Royton Medical Centre's new location. The judgment comes after patients at the practice have repeatedly told the Oldham Times they face enormous difficulty. The GP Patient Survey 2022 also placed the practice as one of the worst in the borough when it came to booking an appointment. However, safety is also a key concern at the practice, which caters to a patient population of 5,915. So I'm all right by saying 6,000, give or take. Yeah, 5,915. You can see the CQC report reveals it is not effective at obtaining disclosure and barring service DBS checks, and it didn't follow the correct DBS process in its recruitment procedure. That means, for all anyone knows, they hired sex offenders, or they could have hired sex offenders. It also found practice nurses are not appropriately authorised to administer medicine. Emergency medicines are not adequately checked, and equipment provided to GPs in a box needed for their surgery was also found to be ineffective. Upon further examination, the CQC found 5 medicine reviews had been completed without patients' involvement, 3 of which had been coded with without all the repeat medicines being reviewed. That's dangerous, isn't it? That's a list of danger, danger, danger. The above amounted to a breach of Regulation 12.1 of the Health and Social Care Act 2008 and Regulations 2014. So he's in breach of regulations of the Health and Social Care Act 2008 and Regulations 2014. The most damning rating comes in the category of providing well-led services, where the CQC rated Royton Medical Centre as inadequate. It found leaders were unable to demonstrate that they had the capacity to deliver high quality care. Policies were not being followed, such as DBS checks, but also in areas such as managing events and complaints. Even the website is challenging to navigate, contains incorrect information. In one instance, a safety alert had not been actioned, meaning patients were not informed of the possible risks of taking a medicine. The above amounted to a second breach of the Health and Social Care Act regulations. So 2 breaches of the actual Health and Social Care Act regulations. They want to see improvements ahead of the next inspection in 6 months. This includes improving its level of cervical screening, monitoring patient satisfaction with a view to improve the low ratings of the GP patient survey, and to ensure care and treatment is provided in a safe way to patients. That's the CQC saying that care and treatment is currently not provided in a safe way to patients. A Royton Medical Centre spokesperson. Why are they allowed to hide behind anonymity? Who was this spokesperson? Olivia Bridge. We welcome the findings of the Care Quality Commission's report into the practice as constructive criticism. It wasn't constructive criticism, it was damning. We recognise it is typical of a national picture of general practice at a place of post-pandemic and scarce resource. No, it's not. The centre a few hundred yards away was inspected as good. Keeping up with the changing processes has not always been easy. These are not changing processes. What you were found short for were not changing processes. DBS checks are not new. And of course, it goes on. Our pioneering work around homelessness. Constructive feedback is worthless unless acted upon, and we can assure the community that issues raised in the CQC report have already been acted upon and addressed. If that was true, right, that's their statement. If that was true, constructive feedback is worthless unless acted upon, and we can assure the community that issues raised in the CQC reports have been acted upon and addressed. Right, not me. In this first thing were Olivia Bridge, and someone should ask her why she hid Dr. CHAUHAN's name. After, through the Recusant Nine platform, we exposed what had gone on and who this surgery belonged to. She follows it up with this article. Royton leaders express commitment to improve GP services. Let me show you. But despite assurances from the council that it was investigating the practices, well, I don't know why it's investigating the other one, that's by the by. They're just trying to, muddy the water. The CQC report suggests little improvements have been made at RMC, that means Royton Medical Centre. So despite The spokesman at Royton Medical Centre saying, no, we fixed it all, or as good as. The CQC report suggests otherwise. The surgery is currently managed by Oldham's Deputy Mayor, Dr ZAHID CHAUHAN, a former healthcare cabinet member on the council. That only came out as a consequence of the Recusant Nine transmissions. It would have been hidden from the people of Royton. It would have been hidden from the people of Oldham. Why is the council declining to comment about the CQC report? How can the leaders express commitment to improve GP services in Royton, yet at the same time, the council decline to comment about the report? Why is the council declining to comment about the report? But the local authorities leader, who represents Royton South, Councillor Mandy Chadderton, said she had acted this week by bringing healthcare leaders from both the Royton practices together. Councillor Chadderton said the meeting revealed patient care is key concern for Roytoners. Well, if patient care was a key concern, as Councillor Chadderton is quoted here, then Councillor Chadderton will be at that meeting on Thursday night, won't she? Otherwise, these are just empty words, political rhetoric, and she's just taking the piss out of all of you. She will apparently keep Roytoners in the loop throughout the process of whatever they're doing to ensure that services get better for them. Councillor Basforth, Stephen Basforth, you can see, there is no easy fix to the problem, but we will continue working with them being the doctor surgery, Dr Chauhan's doctor surgery, until we get it right. So if there is no easy fix to the problem, as stated here, why did the spokesperson the joys of adverts. Why did the spokesperson from the medical centre, Royton Medical Centre, the unnamed spokesperson, say this? Issues raised in the CQC report have already been acted upon and addressed. So who's telling the truth? The unnamed spokesperson who's saying issues raised in the CQC report have already been acted upon and addressed. And look, it's not me saying this, it's here in this report. Yet here, Councillor Basforth is saying there is no easy fix. And then the Conservatives, Dave Arnott, has said they have been working for some time to address the GP issues in Royton. Well, I think the people of Royton would like to know how you've been working for some time. Myself and Councillor Quigg have been contacted by several residents regarding the service they receive from GP practices in Royton. Councillor Arnott said his party had several meetings with constituents. I don't know of any meetings with constituents. Do you? In Royton? Tell me. Tell me, people of Royton. Have the Royton Conservatives, Arnott and Quigg, held meetings with constituents? You're the constituents. There's a public meeting on Thursday. It's at the band club, 7:30. That's what a meeting with constituents looks like, Councillor Arnott and Councillor Quigg. Councillor Arnott said his party he'd written to the Royton GP surgeries in October and offered to chair a meeting. However, he said no reply on the offer has been received, but noted this was before the CQC's report was made public. So what's that got to do with anything? Do we need to know about the damning conditions at this medical centre first? The councillors now have a meeting scheduled this week with representatives from NHS Greater Manchester Integrated Care Trust. Bullshit. Irrelevant. How can they have all of these meetings with professionals and professional bodies without first of all meeting the members of the public who are affected, whose lives have been put at risk? How can they avoid everything but meeting the members of the public? Jim McMahon, the disgrace that he is, and you lot vote for him. You lot in Royton vote for him. Across Oldham, our hospital has been judged requires improvement, and we have 8 care homes and 4 primary care practices with the same inspection outcome too. Following the CQC inspection in Royton, I have sought and received assurances from the practice that the findings of the inspection have been acknowledged and that there is a plan in place to ensure all aspects of care are up to the highest possible standards. Nonsense, Jim. You should be condemning it. You should be calling it out. The only time you've commented is after we exposed that your mate runs it. Where was your statement prior to this? And apparently he's witnessed firsthand how the health service is under immense strain with staff working hard to keep things going. So, you know, what that fundamentally means is that there's no money. Yeah, they're blaming the government. There's no money. I want you to hold that thought. There's no money. And also, there's the contradiction in what McMahon says. There is a plan in place to ensure all aspects of care are to the highest possible standard. Well, if there is a plan in place, Dr Chauhan should be at that public meeting on Thursday and sharing with the concerned people of Royton what that plan is. And if there was a plan in place, because Councillor Chadderton said the council met with GPs from across the 2 surgeries with Oldham NHS leaders to discuss an action plan. If there was a plan in place, Chadderton would not be meeting to discuss an action plan, would she? You don't discuss an action plan if a plan is already in place. Lies, deceit, cover up. Is that what Peter Brown's, strapline is? Lies, deceit, cover up. You can see the contradictions just in this. So let's say it's about money. Let's say it is about money. I don't believe it is, by the way. Because there are other medical centres doing well with identical circumstances. There are good medical centres inspected in Oldham by the CQC, and there are also outstanding ones in the area as well. If you're finding value, one of the 111 who are watching, please consider liking, sharing, taking a subscription out on the webpage. Perhaps buying me a coffee or a samosa on this very cold morning. I've got my skiing. I don't ski, but you know what I mean. And that's my hot water bottle I'm sat with. So if you find value in my work, because no one else is doing this work for you, at the very least, press the like button. For those who want to buy me a coffee, I saw Oldham Eye, or someone, will you please put the link up as a comment, or I'll try and share it again. Just give me 1 second. Here we go. It's at the top. I'm waiting in for an Apple laptop to arrive. I've bought a refurbished one. So hopefully I'll be back up to full speed during the week. To those of you, well, you lot don't, but those of my critics who complain about the income I have from the Buy Me a Coffee site, all of the income from the Buy Me a Coffee site has always gone towards buying and maintaining equipment and the subscriptions I need and all of that sort of stuff. Cost me £1,600. I'm not happy about it. Okay. I say it's about money. The Oldham Chronicle article has been pulled, as we now all know. And the Oldham Times article, again by Olivia Bridge, is in a slightly different angle, but it's still there. Oldham Deputy Mayor denies wrongdoing after Lib Dems make allegations. A political row has broken out between Oldham Liberal Democrats and the council after the party allegedly made false financial claims to smear the deputy mayor. The Lib Dems have accused Dr Chauhan. Sorry, I'll just bring this bigger. The Lib Dems have accused Dr ZAHID CHAUHAN, OBE, Oldham's deputy mayor, former healthcare cabinet member and the practice manager at Royton Medical Centre. Oh, so now he's the practice manager. Okay. So when we go back and reanalyze the CQC report and it says the practice manager said, we now know who the practice manager is. It's Dr ZAHID CHAUHAN. So if Dr ZAHID CHAUHAN is the practice manager at Royton Medical Centre, Olivia, before we carry on, why is Dr ZAHID CHAUHAN's name not on the webpage? Why is Dr ZAHID CHAUHAN's name not on the webpage? I'd imagine practice manager is a significant role. He's actually the senior GP partner, but that's by the by. The Lib Dems have accused Dr ZAHID CHAUHAN of failing to declare a series of payments from the council. The party said the Labour councillors' company, inverted commas, Bardock Limited, received 14 separate payments over a period of 9 months throughout 2021 and 2022, totalling £637,042, which he failed to declare. Again, failed is in inverted commas. However, Dr Chauhan vehemently denies the allegation, claiming his interests have always been transparent and that Bardock is not a company he owns. So he's getting into semantics here. He says he doesn't own Bardock. We'll get to that in a minute. The council also confirmed to the Oldham Times that Dr Chauhan's employment at Bardock was declared and that he was not involved in the decision-making process of the contract. And we'll get to that again. His employment was indeed declared, but his employment was declared after, on his declarations, after the contracts had been awarded. You just got to follow the timeline. Lib Dem Shadow Member for Health, Louis Hamblett, who pointed out the series of payments, said the rules are clear. If you have a contract with the council, you're meant to declare it before it happens. So declaring a contract with the council is different from declaring your employment. They're not the same. They're not one and the same. He is that, isn't he? Where is he? Where are you, Dr. Chauhan? Dr. Chauhan failed to do this before each of the 9 months that the 14 payments took place. Instead, he filed paperwork a year late. I'm presuming what he means by filing paperwork a year late is his declaration of interest. Updated declaration of interest. I don't know what he means by that. Because of a loophole, which means you don't have to declare past payments, only future ones, all of these payments effectively remain hidden. Well, they don't. Not anymore. Lib Dem Shadow Cabinet Member for Economy, Councillor Mark Kenyon added, while Labour were decrying dodgy Tory COVID deals, Oldham Council paid over £600,000 to a healthcare company owned by the Labour Cabinet Member for Health. So that's Councillor Mark Kenyon explicitly saying that Oldham Council paid over £600,000 to a healthcare company owned by the Labour Party Cabinet Member for Health. Remember, these aren't allegations I'm making. I've never made these allegations. I've only responded to these financial irregularities, queries, following the Oldham Chronicles report and the Lib Dem statement on their own Facebook page. Yet the latest accounts detail that no profit was made on a £13 million turnover. The payments were made to Bardock Limited, which claims to return all profits to the community. Yet the latest accounts detail that no profit was made on a £13 million turnover, despite £107,000 paid to Dr. Chauhan, Councillor Chauhan, directly, and another company, AZ Medics, which is owned by Councillor Chauhan. Which Councillor Chauhan also confirms in his declaration of interest that he owns AZ Medics. And Companies House back this up. Whilst the Lib Dems said they recognised Dr. Chauhan did in fact declare his interest to the council and his close colleagues, actually that word has changed. So this is no longer, this is Olivia Bridge now talking, not Mark Kenyon. While the Lib Dems said they recognised Dr. Chauhan did in fact declare his interest to the council and his close colleagues, he didn't declare it to the council because this is from his close colleagues' reference is from Harry Caffrell. And Harry Caffrell made reference to it being, never mind, declared to his close colleagues, which doesn't count. You can't tell your mates, your close colleagues, you're a director and not filling the forms. They said the GP should have declared his interest to the people of Oldham, of whom he is accountable, and the way you declare it to the people of Oldham is through your declaration of interest that you update and fill in online. The councillor said they are not accusing the Deputy Mayor of criminal misconduct, but they have demanded he proves Bardock either made no profit or the contract, or he returns all the profits to the council. It's simple, isn't it? The council suggested this would be unnecessary since the contract was made with Bardock without Dr. Chauhan's involvement. Why was it made with Bardock without Dr. Chauhan's involvement if Dr. Chauhan has not declared the interest in his forms? He said he has always acted with integrity. And he's donated his annual mayoral allowance. Well, in my time working when I was younger, I worked is the wrong word. I encountered many a mobster and drug dealer who did lots for charity as well. Donating your entire deputy mayoral allowance has no bearing on what's taking place here in terms of Bardock or at the failings at Royton Medical Centre. He's claiming he did not receive any personal payments in relation to the contract for swabbing services. You can see it there. Bardock is not my company, as the Liberal Democrats seek to suggest, and I did not receive any personal payments in relation to the contract for swabbing services. I consider the false allegations made by the Liberal Democrats nothing but an attempt to smear my reputation. Well, Dr. Chauhan, you should be suing Kenyon and Councillor Hamlet, shouldn't you? You should be suing both of those councillors. If this is true, if these are false allegations as you suggest, and you vehemently deny any wrongdoing, and you claim that the council has also confirmed it is satisfied by my removal from any decision-making process, and I've not seen anywhere a statement from the council saying anything of the sort, then you should be suing them. And then he's, proud of. A spokesman for the council added, Bardock was contracted by Oldham Council to provide vital community testing to supporters during the COVID-19 pandemic. First of all, a 12-month contract was awarded in March 2021, and a further 12-month contract was awarded in February 2022. The council is satisfied that both at the point that decisions were made around the original contract and at the point of contract was extended, Dr. Chauhan declared his interest as an employee of Bardock. Okay. They are claiming, we're clear here, that Dr. Chauhan declared his interest as an employee of Bardock at the point the contract was extended and at the original contract. Well, Dr. Chauhan wasn't an employee of Bardock, according to the company's house records. Never mind. Contradiction after contradiction, all right? So the council are covering for the doctor. I think that's clear. Or the council are covering for themselves. They want it all to go away. It's one or the other. Or a combination of both, I'm not sure. And again, a spokesperson for the council. Who is this spokesperson? Why are they nameless? Does the spokesperson hang out in shisha bars? Maybe have a side hustle in a chicken shop? A mocktail bar? I don't know. Who is this spokesperson for the council? So at the centre of this is this thing called Bardock, and I couldn't make sense of it. I looked at the company's house stuff and I couldn't make sense of it, and I couldn't make sense of it, and I couldn't make sense of it. So I went looking last night. Bardock is what's known as a community benefit society. So he's saying he doesn't own it because a community benefit society, I'll make this bigger so you can see it, is an interesting structure. So a community benefit society is actually registered with the Financial Conduct Authority. So it's not registered with Companies House. It's registered with a different regulator and it's owned by its members. The society is established for the benefit of the community and not of its members, who do not need to be. Right? A community benefit society is a form of cooperative whose purpose is designed to benefit the wider community. Remember, benefit the wider community. It is a limited company, so it is a limited company, and must be registered with a Financial Conduct Authority rather than Companies House. Do community benefit societies have directors? This does not affect the society's registration, and the FCA Mutual Public Register should be used for confirmation of registration. Societies have directors. Some societies will use the term directors in their rules. Others may call the directors committee members or sometimes trustees. There you go. So it is your company. If you are listed So it's not your company in the sense that you can take profit from it. You can sell the company on, but it is your company. If you're listed on them, yeah? With the FCA Mutual Public Register, because why else would we be registered with the regulator if it's not your company? My name's not on it. Your name's not on it. You ready? You ready for the good stuff? You still with me? I was up till 2 in the morning. This is the Financial Conduct Authority. Yeah. Let's see if it works this way. Bardock Limited. You see it? Let's click on Bardock Limited. Cooperative and Community Benefit Society, 22 Derby Way, Bury, Lancashire. And I've checked the address, and that's an address linked with one of Dr. Chauhan's businesses. I can find it for you if you want. Just give me a second. See this? Bardock Family Practices, Rolf Healthcare, Moorgate Primary Care Centre, 22 Derby Way, Bury, Lancashire. Yeah. Yeah. 22 Derby Way, Bury, Lancashire. Same address, yeah. It's not the same company, even though he uses the name, which got me confused as well earlier on. But we've got round that. You can see it here. 22 Derby Way, Bury, Lancashire. So Bardock Limited, even though it's a cooperative and community benefit society, is registered at the same address as one of his other companies, which is also a health centre. Documents. I'm going to go back to the oldest documents first. (31st of the 1st, 2012). Yeah, so that's 10 years ago. You can see governance, members meetings, all of that. Council of Governors, Board of Directors. Do they have directors? 6. You can see Board of Directors. Let's go to 6. The Board of Directors shall comprise of 4 executive directors and 5 non-executive directors as follows. There's 4 names here. But not Dr. Chauhan's, right? There's a Zahir Mohammed, but that's not Dr. Chauhan, so bear with me and I'll show you something. Okay, so that's the first document. Have a look at this one. Company becomes a society. Yep. 2012 again. Bardock Limited, yeah. 31st of January 2012. Yeah. Series of documents the same. Yeah. I won't bore you with the 42 pages. What I'll show you first of all is the first set of annual returns, 31st of March 2014. Date received 29th of September 2014. You can see the stamp. Derby Way, Bury. Yep, the address is there. Dr. Robert Stokes, Karen Kenyon. Details of secretary, Vicky Riding. Members of the committee. Dr. ZAHID CHAUHAN's name is there. Yep. Is there. Black and white as far back as 2014. So his employment in 2022, when he was registered, or 2021, when he was registered as working there as a CEO, is irrelevant because he's clearly in the paper trail all the way back to 2014. So I'm not going to go through every set of annual accounts and returns with you, but I will go through the last one with you because I think it's relevant. The 31st of March 2020. Name of directors. So there's 4 people. Directors. Name of director. So the term director of the company is relevant, is appropriate, because here it is on the actual form, name of director. Agreed? It's not me. This is the form. On the FCA's own webpage, submitted. There are 4 directors, 4 individuals on this organisation. Vicky Riding, Robert Stokes, Bracegirdle, Dr. Andrew Bracegirdle, and Dr. ZAHID CHAUHAN. Oh, I'm younger than Dr. ZAHID CHAUHAN. How you all doing? You with me still? You listening? Yeah, it's that. It is that. Okay, thanks, Julie. You're all still here. Sorry, you're all gone. Went very quiet. No comments. So I'm presuming you're all listening. Great. Close links, including any directorships or senior positions held by directors of the society in other organisations. AZ Medics, Leela Limited, Whitworth Medical Centre. Yeah. Dr. Chauhan's Declaration of Interests. Whitworth Medical Centre, you can see at the bottom. AZ Medics, you can see there as well. So these are places where he gets money from. See, carried out on profit or gain. Yeah, it's there. So the only one missing there, unless I can't see it, is the Layla one. Yeah. Leela Limited. I'm not sure what Leela Limited is. You guys might want to go and have a look. And they got 389 members with a turnover of 13 million and assets of over 2 million. And it's a full professional audit, this, okay? Their own documents, not me. And what they do is they provide out-of-hours health and dental care for the population of Bury, Hayward, Middleton, Rochdale and Bolton. Why is that relevant? Read that to me and tell me where Oldham appears on that list. This is a cooperative society, a mutual or some form. Their constitution, very specific. This is their own form. They provide out-of-hours health and dental care for the population of Bury, Hayward, Middleton, Rochdale and Bolton. What is Oldham Council doing awarding a contract to a company that does not provide services? And how qualified was Bardock in providing the services they were contracted to do? Because I don't remember it being dental care, do you? Again, in case I got it wrong, the community they serve, out-of-hours health and dental care for the population of Bury, Hayward, Middleton, Rochdale and Bolton. When you set up a mutual or cooperative organisation, the area you serve is you're limited to. So if you go and work somewhere else, you've got to change your constitution, your governance arrangements. I can't set up a charity that says I'll work in Oldham and then go and work in Rochdale or Bolton without, because I'm in violation of the constraints of what I've done. I've agreed to at the beginning. That's not the worst of it. Much worse to come. Is that Bardock's fault that they went and got the contract? Oldham Council shouldn't have been awarded any organisation whose constitution does not allow them to work in that area contract. That's what shouldn't have happened. They shouldn't have applied for the contract, but they shouldn't have been given it either. What did the society do with any surplus of profits? This is his get out. All of their get out. Invested back into the service provided. So they don't make any profits. They invest it all back into the service provided, which is why it's a mutual. For the year ending 31st of March 2020. So the second contract the Oldham Council have come up with won't be in this. Remember? The contract was approved in March 2021 for 12 months and extended for a further 12 months in February 2022. So neither of these contracts are in that, yeah? Because this is for the year ending 31st of March. So it's the year earlier. Yeah, it's the year earlier. So we don't know what's happened and we won't know what's happened but Committee of Management. There's only 4 of them. Dr Chauhan's there. Yeah. Committee of Management Director. Same thing. According as far as the FCA are concerned. They use the word interchangeably, and trustees. You're responsible. You're in charge. You're accountable. You decide where the money goes. You decide where you go and work. Something goes wrong, it's on you. Registered office is Moorgate Primary Care Centre. Here is his declaration of interests. Moorgate isn't on there, is it? Get to his C, and you can see contracts not aware. So he's not aware of any contracts. Strategic report was up till 2 in the morning. Let me show you. The Society's not-for-profit social enterprise status means that any surpluses generated are directly reinvested back into the services provided to benefit the community served by Bardock. For the year under review, turnover was 13 million. Losses were 333,000. To talk about some of the key. Yep. Dr. Chauhan is the person who signs off the report as the officer by order of the Committee of Management, Dr. Chauhan. So he's not just on there, he's the one who's signing the documents. Do you see? He's the one who's signing the documents. And Kay O'Brien is the deceased, so he's died. That's why there's now 4 of them. There used to be 5 of them. And that's the auditors, Champion Accountants LLP. And this goes to the members, so all 330 members get this, yep. $13 million, you see that? Again, Dr. Chauhan's signature there, do you see? Again, Dr. Chauhan's signature there. So I'm just working my way through this, but there's somewhere I'm going to, don't worry, I'll show you. They've got 5 officers, yep, employees, direct staff 332, administrative staff 105, but ignore that, it's the 5 officers I want you to look at. Wages and salaries just under 3 million. Officers' remuneration, £237,949. Subsidiaries. Remember we talked about Rock Healthcare Limited? Well, there you go. Rock Healthcare Limited appears here. Two things I want to show. One I've missed somewhere, so you'll have to find me, which shows how much the highest paid person got. And it was 120 something thousand. If you bear with me, I'll find it. Remuneration. Okay, that's funny. Disclosed above includes the following amounts paid to the highest paid officer. So the highest paid officer ordinarily in an organization is the chief executive officer. Yeah. So in 2020, they paid the chief executive officer £123,521. So they're in black and white. Sorry. In his declaration of interest, Dr. Chauhan's declaration of interest, you can see here he's a chief executive officer of Bardock, CEO of Bardock. So you'll have to ask him how much he earns from Bardock, but the highest paid officer from Bardock several years earlier received 120 something thousand pounds. Sorry, this keeps going back to the beginning, which is a problem. There you go. Sorry. Bear with me. Remuneration for quality. You know, in 2019, you're right, old am I. The highest paid person got 103,000. In 2020, it was increased to 123,000. So 20 grand uplift. I don't know how much it is in 2021 or 2022, but Dr. Chauhan, I think it's in the public interest that Dr. Chauhan should declare how much he earns as a chief executive officer of this not-profit company that is a director of, listed as, you can see, not me, here in the forms. We're not done, my friends. We're not done. Bardock Limited, because this is a full audited account, has got to release what's called related party transactions. Dr. Chauhan, in 2020, remember, there's a figure he is paid in related party transactions, 25,761. And in brackets it says 2019, 95,761. So in 1 year, in terms of, there's more. The following charges were made by the officers in respect of medical services rendered to the society in their capacity as general medical practitioners in carrying out clinical sessional work. So 95 plus 25 is what? 120? Plus 7, 122 grand, give or take. Yeah, so there's £122,000 there. Now more. We've got more. The following charges were made by the officers in respect of their capacity as providing management services to the society. Another £21,091. Do you see? 95,761, 25,761, 21,091. I'm going to get my calculator in a minute. By virtue of common officers and directorships, Leela Limited, the society paid rent, so it's not Lena wasn't one of his, or we've not been able to find. AZ Medics, 82,000, a further 82,241. Whitworth Medical Centre is on that, isn't he? 60,000. No, they owed that, so he owed that, so that's not a cost. Okay. But Whitworth Medics didn't pay, owed them money, so that's another one of his companies that owed them money. Let me just get my calculator out. 25,761 plus 95,761 plus 21,091 plus 82,241, 224,854 pounds, and then one of his companies also owes this mutual not-for-profit 60,000 on top of that. Best part of £300,000. And this is before whatever it is Oldham Council did it with them in 2021 and 2022. And all of this is separate to whatever he's doing in his medical practices that he owns and other businesses that he owns. The society and group was controlled by the Committee of Management. And the Committee of Management consistently signed off all of these documents as one of four is Dr ZAHID CHAUHAN. Not me saying this. It's here in this form. For those of you who are new to this, my name is Raj Amir, the MBE flask. I do indeed have an MBE. I'm also due in court for another attempt by the police to prosecute me. They've been trying for over 4 years as a consequence of Jim McMahon MP, Dr Chauhan's best mate. Doctor mate. Best doctor mate. I don't know. Apparently, according to Oldham Council, nothing to see here. According to Dr Chauhan, he's done nothing wrong. Bardock isn't his company. And Amanda Chadderton on record saying it's not for profit. It's not for profit. In just 1 year's accounts, we just pulled out the best part of £300,000, 220, 200 and just under £250,000 paid out to Dr. Chauhan, or companies linked to Dr. Chauhan directly, and £60,000, £70,000 owing by companies linked to Dr. Chauhan. Not me, here. And it took me ages. It took me ages to get to this. So if you find value in my transmissions, and they are due to finish at Christmas, come on, who else is going to do this? Olivia? Do you think Olivia from the Oldham Times is going to do this? No. And of course, if you wanted to look at another document, let's look at 2019. Let's just quickly look at 2019. I have an MBE and I'm doing... I have an MBE because I stuck my neck out for this country, Julie. I stuck my neck out for this town. I stuck my neck out for the people I care about. And the dice landed favourably. This time I've stuck my neck out and they're trying to put me in prison. I've not changed. I've not changed in this at all. Gravy train, more like gravy private jet. If you find value, please do consider buying me a coffee. Share the transmissions. Come on, people. There's 30 of you, 30 likes. I've got 164 people viewing. Would you have found this document? Never mind being able to go through it and pull that out. Would you have found this document? The year before, you can see Dr. Chauhan's name's on it. There's something in Bardoc's paperwork I saw last night. I'll have to dig it out. Someone ran off with £250,000 somewhere in its history. Someone ran off with £250,000. No, I'm not joking. Someone somewhere ran off with £250,000. Dr. ZAHID CHAUHAN's other directorships. Oh! Leela Limited. Do you see? Leela Limited. So Leela Limited is there and Dr. Chauhan is linked to it. You'll have to ask him why he's not putting his register of interests on the council. I'll be honest with you. It's 1:45 on a Tuesday afternoon. I'm absolutely freezing where I am. I am with a hot water bottle in front of me. My daughter's hot water bottle behind me. And I'd much rather, if I had my way, to those from Oldham Council and all the haters watching me, if I had my way, I'd be working with a bunch of young people somewhere. But you lot tried to make me out into something I'm not. And here I am. The word we have in Islam is kismot. Fate, destiny. Would you have known? Would any of you have known? So it's the same sort of form filled in again. Again, what did a surplus of profit reinvested back into the services. I've just seen this time someone else is signing it. But it's Dr. Chauhan's names though. You can see Committee of Management, Dr. ZAHID CHAUHAN, Dr. Z Chauhan, same address. £12 million that year, not 13.5. Let's go to the end page. The end page is the notes for related party transactions. We've already had the 95,069, haven't we? In 29. So we've already done that. Yeah. So there's no point to add that on the title again. In 2018, he was paid £79,074. And a separate payment of £21,091. And Leela Limited, the society, which Leela Limited, that Dr. Chauhan is a director of, rent of £25,000. You can see, can't you? You can see. It goes on and it goes on and it goes on. You can look at it every year and you'll see it go on every year. But I'm curious. I'm curious what I've seen that. Here we go. I knew I'd seen it. Let me bring it up completely so you can see it. So this is Dr. Chauhan's company. You know, he's a director here. The group has continued to operate efficiently, proactively and effectively across the range of services delivered. The year has seen a reduction in profitability, mostly due to the fraudulent misappropriation of funds, and the officers report that the losses suffered decreased the group's reserves by £338,657. So misappropriation of funds, fraudulent misappropriation of funds. So someone's had £338,657. Still, you can see it. The officers report that during the period from April 2015 to July 2020, the society suffered a misappropriation of funds totalling £267,294 by an employee acting fraudulently. Apparently, they've taken appropriate measures to prevent a similar incident occurring again. So over 5 years. Over 5 years, Lynn, which makes it worse. Okay. What do you want me to say? What do you want me to say? Jim McMahon, MP, claims that things are in a mess because of the absence of money. I've just shown you where some of that money is going. Amanda Chadderton was quick to point out Bardock is a not-for-profit company. Well, clearly it is a not-for-profit company if it's paying out hundreds of thousands of pounds through the framework it's allowed to Dr. Chauhan. How can it be generating profit if the profits are not the profits? If Dr. Chauhan is claiming 90,000, 100,000, whatever, year on year. And now he is also the chief executive officer. I can only share with you my opinion. My opinion on all of this is that the serious fraud squad should be called in. Bardock themselves have admitted that their own employee has run away with $250,000 to 300,000, God knows, an obscene amount of money. Public money, contracted money. Dr. Chauhan is claiming he didn't receive any income from the contracts from Oldham Council. It was all declared, but it's not declared on his forms where it should be declared. There's companies Dr. Chauhan is making reference to here that is a director of that don't correspond with his declaration of interests with the council, with you, the public. He's claimed he's the CEO of Bardock on his declaration of interests. Let's bring it back up. When the role of being a CEO of Bardock is different, it's a paid role, CEO of Bardock. Does it say? You can see. It's different to there you go. Contracts. He's not aware. He wasn't aware. I mean, that's an outright lie, isn't it? Because how could he have removed himself? How could he have removed himself? And how can the council say he's removed himself from meetings where contracts were discussed with Bardock and awarded with Bardock? If then here, where he's a chief executive officer of Bardock, he's saying he's not aware of any of these contracts. If he was not aware of any of these contracts, he wouldn't be removing himself from the meetings, would he? You know why they've got away with it, Julie? And I say this without any arrogance. They've got away with it because someone like me hasn't been around to do what I do. It's no more complicated than that. I've been on for the best part of 2 hours on an impromptu transmission. I hope you found it of value. My transmissions are due to end in just over a month's time. I am off to work in a factory somewhere, I think. And the reason for that is not because I want to. The reason for that is I can no longer afford to continue doing what I'm doing, continue to do this That's because I can't even get to £1,000 fucking pounds a month to keep my heating and lighting on and feed myself and my kid.
Do not fear them. Do not fear any of them.